I will shortly call on the Minister for Health and Children, Deputy Mary Harney, to make her statement under Standing Order 43, and then in accordance with the order of the House, I will call on the main spokespersons of Fine Gael, the Labour Party and Sinn Féin to make their statements of up to 15 minutes, and members may share time. And there will be a questions and answer session at 1:30 for half an hour. The Minister for Health and Children, Deputy Mary Harney.
Thank you, Lascan Cora, and I'm happy to have an opportunity to speak about this issue here this afternoon. Can I say, in the context of the cancer programme that the government has embarked on, there are a number of priorities from a clinical point of view. And the first priority clearly is to ensure that we organise our cancer services to deliver better outcomes for patients. The manner in which our cancer services have been organised do not deliver, as we know, good outcomes for patients, and we do not compare very favourably with many other European countries in most cancers, with the exception of children's cancer, which is centrally organised in Crumlin, and therefore we do extremely well, not just in Europe, but among other countries in the world. With other cancers we don't do so well. So a priority over the last 18 months has been to invest in putting in place 8 designated centres with a multidisciplinary team of experts to be able to care for patients who are diagnosed with cancer. A second priority are screening programmes. Unlike many other European countries, and indeed countries beyond Europe, in the area of screening, they have been involved in this for quite some considerable time. We are currently rolling out a breast screening programme, and that will be completed during next year for those 5 counties, I think, that haven't yet had the breast screening rolled out. We're also rolling out a cervical screening programme that began in September. And cervical screening has the capacity to prevent 80 to 90% of cervical cancers. We get somewhere between 70 to 100 cervical cancers a year. A national screening programme for women between 25 and 60 has the capacity to eliminate cervical cancer by 80 to 90%. So therefore, when the choice came between the rollout of the cervical screening programme, which next year in a full year will cost 35 million, an extra 25 million is going into that next year, an extra 15 million into the cancer control programme to allow Professor Keane to continue to recruit the expertise we require in these 8 centres in order to provide in particular multidisciplinary care. So that 50 million has been identified for those 2 programmes. In the summer of this year, after a health technology assessment, I did announce, based on the advice I received, that we wanted to also introduce the vaccine from the school year beginning September 2009. It was the case that the HSE felt at that time that was going to be a challenge, because they have sought, in the context of this, as health services often do, computer systems and so on. But we felt it should be rolled out at the earliest opportunity. And in the statement I made on the 5th of August, I said, subject to 2 things. One, that it was cost effective. We have 2 companies that supply the vaccine. One of the vaccines deals with 4 strains of HPV. There are 200 strains in all. One can eliminate 2 strains. The other, I think, deals with 4 strains. And subject to cost-effective procurement and getting an 80% take-up, because all the advice is that we don't get an 80% take-up, we don't get the benefits of introducing this vaccine, and therefore the permission of parents of 12-year-old girls would be sought. And that's subject to those 2 criteria that I would seek government funding in the context of the estimates for 2009 to begin the rollout in September of next year. Since then, as we know, there has been a considerable decline in our economic circumstances. Next year, for the first year in almost 11 years, health spending will not increase by 8, 9, 10%. The average increase has been 9% since 1997. Next year, the increase will be just over 3% in health spending, and that is going to be a challenge. And as I've said in this House in the context of the debate about medical cards, when one has to find 700 million of planned expenditure for 2009, from the health vote, it is a considerable challenge. There is no low-lying fruit in health. There are no easy pickings. And therefore, it was obvious that something that had not yet begun should not begin next year when we didn't have the resources to do it. Can I say we have to put it in also in the context of the pneumococcal vaccine, which we've just rolled out to infants, and we have a catch-up period up to 2 years, and that's going to cost 30 million next year to prevent certain meningitis strains. So it's not a question of just this in isolation for many other big decisions that have been made. On Tuesday I was asked parliamentary questions by Deputy Riley and one of his colleagues, and there were also queries from a journalist, and I gave the truthful answer that we're not going to be in a position to provide money during 2009. Now, can I say this is because the American election was the same day, I'm accused of trying to go undercover and make the announcement on the day of the elections. I believe when parliamentary questions are answered, to answer them truthfully and not to mislead people into a false view that sometime next year we were going to have this vaccine, when I knew in my heart of hearts I did not have the money to do it. And when the HSE sent me their plan a couple of weeks ago, and we discussed it with officials in the last 2 weeks in the department, it was clear to me that we could not provide the additional resources without taking them either from Professor Keane's cancer control programme or scaling down on the screening programme which we've begun. And I believe when we begin something, we should do it well. And therefore, when it came to clinical choices, we had to continue with the decision that gives the best clinical return. And the best clinical return is in relation to screening. That saves 80 to 90%, as we heard from Dr. Flannelly on the radio this morning. Screening prevents 80 to 90% of cervical cancers. This vaccine has the potential to prevent 70%, but these women vaccine would also have to be screened. It's not a question of either or. Many other countries have introduced a screening programme, in the UK for example 20 years ago for cervical cancer. We're only doing that now because unfortunately we had different priorities and we didn't have the resources that other countries have to have cervical screening programmes 20 or so years ago, and our screening programme, as everybody here knows, only began last year. The announcement on Tuesday, or began this year in September, the announcement on Tuesday was not that we were scrapping the vaccine. What we said was it is not being introduced beginning September of next year. And the challenge for the HSE is to ensure that when the programme can begin, and one would hope it could begin as quickly as possible, and I can't stand up here and say it'll be 2010, I would hope it could, but I can't give that guarantee now unless the resources can be made available to do that. But I hope that we will be able to introduce it as early as possible. Other European countries have not been in a position to introduce it either. Can I say in relation to the costs, it has been suggested that the 3 doses would cost about €600 or €200 each. I don't know if that is the case. The HSE have estimated to me that for next year, for a full year, it would cost about 16 million. The administrative cost of the vaccine is something in the region of 6 million. And obviously if one hasn't gone to procurement, I can't with certainty say what the cost of the vaccine would be, except I understand it's been suggested that if people can procure this privately, we're talking about €600 a dose. When the HTA was done for me by HIQA, they were talking about it costing €390 for the vaccine. There are about 27,000 girls aged 12 in Ireland. We want to get an 80% take-up. On the assumption that we do, and that was the only basis on which we were going to proceed, you're talking about somewhere in the region of 11 million for the vaccine alone, and as I said, 6 million for the staff to administer the vaccine and for other non-pay and IT systems and so on, because clearly we have to be able to track the people that get the vaccine over a considerable period of time. So, Lascia Corla, I'm happy to be here to explain the circumstances in which this decision was made, to say we would wish we could make all of the decisions that would benefit the health of our citizens all at once. But when it comes to priorities, and clinical priorities have to come first. And the clinical priority, based on all the advice available to me as far as cancer is concerned in Ireland at the moment, is continuing with the reorganisation of services, which next year will require an additional 15 million for Professor Keane, and continuing with the rollout of the cervical screening programme to 1.1 million women, which will cost next year an additional 25 million over the 10 million that was provided for it this year. That's 50 million for those new cancer initiatives. and in addition to the other issues like the pneumococcal vaccine and so on, I'm afraid it just was not possible to make resources available to the HSE from the autumn of next year to begin a programme in either national or primary schools. It's slightly easier in secondary schools from a cost point of view. I think it's £500,000 or so cheaper to do it in secondary schools because there are fewer. However, in terms of getting the consent of parents, we know who the national school students are, and it was my view certainly that it might have been easier to reach those parents and get their consent in advance, which is required for this vaccine, because we're talking about minors, that it may have been easier to organise the programme to the national schools. But whichever schools, whether it was national or primary, the fact is that we cannot begin the programme in September of 2009 as envisaged, and certainly it is a decision that has to be postponed for that reason.